Taking a blood pressure measurement. A good technique and an accurate device are critical to obtaining a valid blood pressure recording. In taking a blood pressure, inform the participant on what you're about to do, and then locate the brachial artery in the elbow crease of the arm by palpation. If you are unable to locate the artery, then you'll be placing the stethoscope on the medial third of the elbow crease. If you do locate the pulse, then it may be helpful to mark this with a pen for future readings. You can then wrap the cuff firmly around the person's upper left arm, making sure that there is no air remaining in the cuff before fitting it to your patient. Ensure that the internal aspect of the cuff is against the patient's skin, not inside out. You will know if the cuff is inside out because when you start pumping up the cuff, the Velcro will start tearing off. The bladder of the cuff should be directly above the artery, and the bottom of the cuff should be approximately 3 to 4 centimeters above the elbow crease. Above the elbow crease. To avoid twists in the tubes, ensure that they flow nicely. Ensure that the pressure gauge is in an upright position and that you can read it. Inform the participant of what you intend to do and the sensations that can be expected when inflating a cuff, such as pressure on the upper arm or potentially tingling sensation in the fingers. And then palpate the radial artery. While monitoring this pulse, turn the air release knob fully clockwise and inflate the cuff at approximately 10 millimeters of mercury per second. When you are locking off the pump, please make sure that you do not over twist the knob, otherwise you can potentially break the device. Inflate the cuff at approximately 10 millimeters of mercury per second until the radial pulse can no longer be detected. Note the pressure at this point and then rapidly deflate the cuff by turning the air release knob counterclockwise. The point at which the pulse disappears is an estimation of the patient's systolic blood pressure. Place the diaphragm of the stethoscope gently over the brachial artery, making sure that you're not pressing your thumb over the top of the bell, in which this can actually allow you to potentially hear your own heart rate and affect the results. Again, if you're unable to locate the brachial artery palpated earlier, then place the stethoscope on the medial third of the elbow crease. Wait at least 30 seconds from deflation of the cuff from the estimated systolic blood pressure, and then inflate the cuff to a pressure 30 millimeters of mercury above the detected or estimated systolic blood pressure. Carefully deflate the cuff at approximately 2 to 3 millimeters of mercury per second by watching the bar and carefully listen to the brachial artery through the stethoscope. The first sound that you hear and that you locate is the systolic blood pressure. You should hear a clear tapping sound for consecutive beats. Continue to deflate the cuff at 2 to 3 millimeters of mercury per second. Take the reading of the diastolic blood pressure when this repetitive sound disappears. The systolic blood pressure and the diastolic blood pressure should be recorded to the nearest 2 millimeters of mercury. You may need to repeat this step several times in order to ensure an accurate reading. Deflate the cuff completely and remove it from your patient's arm. The blood pressure values should be recorded as soon as possible once the cuff is deflated. Clean and disinfect the earpieces using an alcohol wipe. And you can also use the spray in order to clean the blood pressure cuff.